everyone. Welcome to our Family Medical Coping Initiative webinar on preparing your child for medical procedures. We're very happy to have guest speakers, Dr. Lauren Mednick and Caitlin McGowan, Child Life Specialist. For our next slide, please, we advance. The Family Medical Coping Initiative is a multidisciplinary team of a psychologist, me, a social worker, Annie Banks, and a child life specialist, Gail Windmueller, dedicated to providing education to help patients manage medical care more effectively and with less distress. I'm Dr. Elisa Bronfman from the Family Medical Coping Initiative, and our guest speakers are Dr. Lauren Mednick and Caitlin McGowan. The Family Medical Coping Initiative is a program through the Hale Family Center for Families at Boston Children's Hospital. It's a multidisciplinary effort spearheaded by psychology, social work, and child life. The program was developed to provide education, such as this one today, to families and staff about ways to enhance child and family coping. Within the next week, you will receive an email with a recording of this webinar, and it will also be, after a short while, on the Boston Children's Hospital YouTube channel. If you have general questions about this topic during the talk, please put them in the Q&A, and we will try to get to them at the end. And with that, I turn it over to my colleague, Annie Banks.
Thank you, Dr. Bronfman. I'm delighted to introduce Dr. Lauren Mednick today. Dr. Mednick received her PhD in child clinical psychology with an emphasis in health psychology from the George Washington University in 2005, and she's been an attending psychologist here at Boston Children's since completing her training. In her current position in the Department of Surgery, Dr. Mednick's clinical work is focused primarily on helping to prepare patients and their caregivers for surgeries and other medical procedures. In addition to her clinical work, Dr. Mednick has written several articles on preparation and presented on this topic locally and nationally. Welcome, Dr. Mednick. And I'm going to pass this now over to my colleague, Gail Windmueller.
Gail, you're on mute.
Sorry. I'm so happy to introduce Caitlin McGowan. She received her Master's of Science in Child Life and Family-Centered Care from Boston University. Caitlin currently works as a certified child life specialist in the perioperative care coordination clinic and in the outpatient phlebotomy lab. In these positions, Caitlin's expertise lies in preparing and supporting patients and their families for a variety of surgeries and procedures. She also holds leadership positions in the Child Life Services Department and supports patients in the SIM Discovery preparation program. We are very happy to have Caitlin join us for this program. And with that, Lauren and Caitlin.
So here I am telling Gail she's muted, and I do the same thing, right? So thank you all for having us today. I'm going to be speaking first, followed by Caitlin. So I'm going to move the camera a little bit so that you don't have to watch both of us at the same time, and Caitlin can relax for a moment. So just give me a second to get all set up here. All right, there we go. We don't have any kind of financial relationships to disclose. Excited to be here with Caitlin, and thank you all for inviting us to come to speak today. The two of us work together quite frequently in preparing different kids for surgeries. I sort of do the preparation before the day of surgery, and Caitlin is more, works with them when they come for the pre-op or when they're in the hospital for the day of the surgery. In addition to that, I would like all to think about, we're using the word procedures for intentionally, because while the two of us do a lot of work in preparing kids for surgeries, there's lots of other procedures that kids have that don't involve necessarily anesthesia, for example, needle pokes, and all of these tips and things we're going to discuss are relevant to that also. So briefly, our goals, we have 4 goals today. The first is just to do some review of things you probably all know and are aware, especially those of you who are caregivers and parents on this call. What are the common fears and reactions to medical procedures that we frequently see in children? We'll discuss the importance of preparation and how to best prepare your child for medical procedures. I will then hand it over to Caitlin, who will talk a bit more about some strategies you can use with your kids to help them effectively cope with procedures. And then finally, we'll talk a little bit about, these are all things that you as caregivers can do, but when to seek sort of additional support, whether it's from Child Life the day of, or me in advance of time for your child and preparing them for whatever medical procedure is coming up that they might feel a little bit worried about, or maybe just don't know a lot of information about. So I like to start with this, this cartoon says, now, is this procedure invasive or non-invasive? And the reason I start with this is because I think there's a lot of assumptions that we make, that I make myself, that I look at a kid who's having a medical procedure and I assume that the thing they're going to be upset about is getting their IV started. But actually, they're more upset about getting the mask. And so, it's really important as caregivers and as providers for us to realize that each kid is a little different, and what they may view as invasive or scary or challenging is going to be different. And so it's really important to kind of work with the child and find out what it is that they're anxious about or they might feel is invasive. And, relatedly, I want to talk about that all kids have medical exposure and experience. And so I think it's important, many of you, I'm sure, that are on this call because you have a child who has a medical condition that does involve procedures or surgeries or what have you, more than the average healthy child. However, you may also be on this call and not have a kid with a medical condition, or you have another child at home that doesn't have a medical condition, but those children all still need to go to their primary care doctor. If vaccines are important to you, you're getting vaccines on a regular basis. And nowadays, I feel like all I keep doing is telling my kids each week that they're getting another vaccine. They have to go to the dentist. So, just to broaden this topic, that all kids have exposure to medical procedures. And what I think is interesting, and this is related to the last slide about invasiveness, and what I like to say to families is invasiveness is in the eye of the beholder, is that really to ask the child what they think is fearful, is scary. And so you see this list that some kids, it might be the needles. And I think frequently, when you ask a kid what's the hardest part about going to the doctor, they'll say it's the needles. However, some kids really don't like getting, things put in their ears or drops put in their eyes, or even just talking to somebody. I've had kids say to me that the thermometer, they don't like the one that goes in their ear. They like the one that goes on your forehead. I'll tell you a story that just illustrates this concept. I was working with a little boy. He was probably 8 years old at the time, and he was having a urodynamic study. And for those of you who don't know what urodynamic study is, it's a study that involves the child being fully awake, not being able to take anything to help calm them down. And while they're in this state, they have to have a tube put in their urethra where they pee, a tube put into their rectum where the poop comes out, and then a little wire placed in between. So it's pretty, talk about invasive, it's pretty invasive, right? And so when I look at that study, if I were to say what I think a kid is going to be most fearful of or have the most trouble with, I'm going to say it's one of those tubes. And so I'm working with this child and I have pictures of all the steps of what he's going to do from the moment he checks in to the moment he puts his clothes back on and leaves. And I ask him, which of the parts, I want you to put these parts most scary to least scary. And what was surprising is that what he put is most scary is taking off his clothes and putting on the hospital gown. And, maybe it's because that signified to him a loss of control, that he was going to have this, procedure that he felt naked. And so really the intervention was quite simple, calling down to the area where they do urodynamics and asking them, could he leave his clothes on? Could he just take his pants off? And they were fine with that. And he really coped so much better than he had in previous studies. But I think it's a great illustration that what we as adults think of as scary might not be what the kid thinks of as scary. So common reactions, and I'm sure many of you who are caregivers on this call have seen this, whether it's crying, running away, kind of, pushing people away, not sitting still. These are probably the most common reactions. We also have kids that are happily, put their arm out and get let's talk about needle, we'll use needle procedures as an example. And then we have kids that are just really quiet and withdrawn, which isn't their baseline. And so this is a moment when I'm talking, I work in the Department of Surgery, and I do a lot of teaching with the surgical fellows. And I'm really clear with the fellows that it's important to include the parents as part of the medical team, because parents know things about their kid that we can't get in the medical record, and that we as providers don't know. And so, for example, one thing they know about is how do they behave at home. So if this is a kid who is really challenging at home, always fighting their parents on everything, but comes into the hospital and sort of gives up all control and is just sitting there, even though it's easy for us to take care of this kid, I might have more concern about that reaction than the kid who's screaming and crying, which, to be honest, is not so inappropriate for certain age kids when they're getting a needle if they don't get them all the time. And that's, a couple other things just to mention here, is that, one thing is that most kids, especially younger kids, again, unless they are frequently getting needles or some other kind of procedure and they can get used to it. I always say to children, the way you get good at something or the way you get brave at something is by practice. So if you're only getting a flu shot once a year, guess what? It's going to be really hard to get brave, because once a year you have to be brave for that procedure and not again. Unfortunately or fortunately, if you're going to get a injection every day, I'm going to help you really quickly get brave about getting this injection, because you're going to have lots of opportunities to practice. So for most kids, because most kids, even with medical conditions, aren't getting needles every day. For most kids, what I'm looking for as a clinician to see how resilient they are, to see if I'm concerned about their reaction, is not whether they cry and get upset during the procedure. What I'm looking for is how quickly they recover afterwards. So the kids I'm really concerned about are the kids that, 2 hours later are still tearful about it, won't look at their arm for days when they have an IV in it. So really, I'm looking at recovery time and how they're doing. So I think that's just an important thing, that it's actually a 3-year-old who usually doesn't get shots, if they don't cry when they get the shot, kind of is concerning to me. So, it's normal to not want a shot. It's normal to get upset. Same with surgery. We can bring this. I'm sort of doing the lowest, the least, the most common procedure that we see in children. I'm talking about needles, but this could be for anything. So what are some factors that might, we see very different reactions in kids when they're in the hospital, and what are some factors that might contribute to why a child responds in a certain way? And I think even before I talk about any of these particular reasons that I have listed here, I think it's important to note that not one of these factors alone will predict how a child does in a medically stressful situation or in a invasive procedure or non-invasive procedure that some of us might define. That all these things interact. So it's, while I'm going to talk about age and developmental level in future slides too, just remember that in general, younger kids have a harder time with procedures than older kids. But that is not the rule. We've all seen, as clinicians, a 15-year-old have an incredibly hard time getting a blood draw, and a 3-year-old walking in and putting their arm out right away. But I think, age in general, what we see is that younger kids have a harder time. And as kids get older, they have the ability to reason, to remember the last time, and to do a little bit better. But again, there's lots of factors that play a role into that. And here's some of the other factors, sort of just their coping style in general. Do they avoid things? And it's really hard to kind of, they won't engage in coping skills. They won't, they avoid talking about things. Are they temperamentally an anxious child to begin with? So this is just one extra thing that they have to deal with. Parental anxiety, we're going to come back to that in the next slide. Familial and cultural beliefs could play a role. Previous medical experiences. So this could be good or bad, right? You could have a child who their last medical experience was super positive. They worked with a nurse, for example, if we're doing a blood draw, who got it on the first try, who was really, so good with them and talking with them and distracting them. And so when they come back again, they remember that experience. Or that last experience was a lot of needles, lots of tries, didn't go so well. And that's what they remember. Kids, my own children, I'll give you an example for them. I'd like to think that the recency effect, meaning the most recent thing that happened, is what kind of brings you forward. But kids tend to remember, and adults too, it's human nature, the bad time. So even, though I'll use my girls as an example, even though their most recent vaccine went beautifully, they remember the one time that it really hurt, and that's what they get stuck on. So there's some kids that are just like that. And so when I say previous medical experiences, I mean as a whole, which is a reason why, especially when Caitlin is talking a little bit more about some of the coping strategies, it's so important to be using these and preparing our kids so that they can have positive experiences to then help them with future medical encounters. Experience with pain and fear of pain impacts a reaction to something. If kids are if they've had a lot of pain from different procedures, or if they're fearful that they might have a lot of pain. Relationship with medical providers, and then, the type of procedure. So, for example, a kid who's getting something that, is going to take a few minutes and then they get to go home might react differently than a kid who knows afterwards they're going to wake up and have lots of different tubes on them and have to stay in the hospital. But again, all these factors interact with each other. So I want to take a moment and talk about the influential role of parents, because I think if there's one slide in this talk that, and I shouldn't say that, one slide in my half of the talk, because Caitlin might have some other, and she does have a lot of brilliant things to say, but if there's one piece of advice or thing that I would like families to take home with them and think about, is the role that they play in contributing to kids' reactions, to engage, to helping their kids cope. And so what we know is that how a parent responds in a medically stressful and especially an unknown, uncertain situation plays a huge role in how a kid reacts. So kids are always, even adolescents, looking to their parents for how to respond in uncertain situations. And there's been terrific research studies of parents and kids in particular getting blood draws and getting shots that show that the more anxious the parent is, the more anxious the child is. And so that's not to say that you can't be anxious, or that you can't even share with your child if they're having a significant surgery. I'm worried too, because you've never done this. But it is saying that, especially in the moment, trying to maintain some calm, even if you don't feel that way on the inside, but at least on the outside, is going to help your child. And some of the coping strategies we'll talk about give parents an opportunity to have something to do, which can help manage anxiety, to be a coping coach rather than just sitting there with all your worries. And something I always say to parents, especially in situations where there might be another caregiver available or another trusting and loving adult, even if it's not a primary caregiver, is, if you are feeling incredibly anxious and you feel as though that is not going to help the situation, is it better for you to take a step out for a few minutes, as long as there's someone else that can be with the child? Is that actually making a choice to help your child? All right, so now I'm going to talk a little bit more about the importance of preparation and sort of what I do in preparing a child, but also what you all can do in preparing your children, even for things as simple as going for a checkup at the pediatrician, even when there's no needles, just allowing them to know what to expect. So what makes a procedure or a visit successful? So a visit to the medical office or a medical procedure of any kind. So when I talk to my surgical colleagues, they will say completing the visit or a good result, meaning they did everything they needed to do in the visit, they checked all the boxes, or they did the surgery and it went as planned. That's what they think makes it successful. And while I agree with that, and it is the primary goal of what we're doing when they come in for visits, what I would add is the child feels safe and secure and is willing to return. So if any of you have been to other talks I've given, this is one of my favorite stories, so I'll tell it again for anyone who's new. I worked with, through the simulation program here, we were working with a bunch of colleagues who were working with kids with autism and preparing them for getting an EKG, an EEG. So there's all these little stickers that they put on their head, and you can imagine a kid with autism who has a lot of sensory issues often didn't like getting these things put all over their head. And so the team asked us, could you guys jump in and do some simulation, do some practice work with getting the kids used to having those things on their head? Can you sort of simulate or practice what that would be like before the actual study? So in preparing for creating this simulation, this exercise that we could do with families, I asked the techs we were working with, well, how often do you not complete the visit and get a successful result? How often can't you do it? And their response sort of surprised me. They said, oh, we finish it every time. So now I'm a little confused, and I say, well, okay, so why are we meeting? And they said, and how do you do that if you say that all these kids have so much sensory issues? And they said, well, we papoose the kids, meaning we, put something tight around their body to hold them still so that we can complete it. And to me, they are meeting the first goal. They are completing the visit. They're getting a good result. They're getting the data they need. But I promise you that kid does not feel safe and will not want to return next time because we held them down. And so that's really what we were trying to accomplish in that situation. So why is preparation important? So expectation is everything. Kids and parents and caregivers do better when they know what to expect and there are a few surprises. So I've been in the Department of Surgery for 3 years, and my role is to meet with kids prior to surgeries to kind of prepare them for exactly what they're going to experience, not during the surgery because they're usually asleep during that, but before and after. And I used to say, so that there's no surprises. And I think this is where language is very important. I'm very clear now that I say, so we can have as few surprises as possible. Because as we all know, and especially if many of you are caregivers of kids with medical conditions, we can't predict everything. But I can promise you that I can make it so that there's fewer surprises. I can let you know what you're gonna, when you wake up, what will be on your body. What might it feel like? And many times I find that my surgical colleagues and sometimes caregivers I meet with aren't giving all the information with good intention. The idea that, oh, if I tell them, they'll worry about this. And what I try to do is flip it on parents and surgeons. So maybe they're not telling them about the tube that's going to be in the child's penis, which is what, to collect the urine when they wake up from a certain surgery, because that's going to traumatize them. But what would it feel like to be that 5-year-old boy who wakes up and there's a tube down there when their surgery was on their belly? And so really the question is sort of when do we tell them and what do we tell them, not do we give them the information? And importantly, preparation for surgical experiences has been shown to reduce anxiety in parents and children, decrease the use of pain medication, shorten recovery time. There's medical outcomes that are improved when kids are prepared, when kids feel more calm. And what we've seen, we talked before about how, experiences now affect future. And what we know is that when kids are given information that turns out not to be true about their medical encounter, that they develop a distrustful relationship with whoever told them that information, but also the medical team as a whole. So I've had a kid come to me and say to me, actually very recently, the team tries to trick me or the team lies to me. And sometimes, I'll be honest, it truly is that the team didn't give them all the information and didn't want it with good intention, did sort of trick them or not tell them the full truth. Other times, it's the language we use. So we might say to a kid, you'll stay over 1 night. And then something happens and it turns out they stay over 2 nights. And some kids are flexible with that. They're like, oh, well, I understand you didn't expect this. And other kids feel like you lied to me. You said that it would be 1 night. So I'm very careful when I'm explaining things to kids to say things like, you'll probably stay over 1 night. Or most kids stay over 1 night. So it's little things, but it's in an effort so that kids can't turn around and say, that's not what you told me. I use some flexible language. So who to prepare? And I've sort of alluded to this already, that all children need to be informed about what to expect before and after a surgery. And really the art of it is what details to tell a child and when. So, and those are the things that you really need to think about. And I'm going to give you some tips about how to think about those things. So again, I want to be very clear, even before I go through this, that this is a research study that found this to be the ideal times to tell a kid. But every child is different, and you're going to not only consider their age, but their coping style, previous experiences, their desire for information. And so it very well might be that a teenager, on this slide, it says they're best involved from the beginning. I've met with lots of teenagers that have a sense they're having surgery. It's not that we've totally kept that out of their head, but they don't know the details, and they don't want to know the details until right before the surgery, because they're aware enough to know, I'm an anxious kid. If you tell me this 2 weeks before, I'm just going to spend 2 weeks constantly thinking about it. Tell me the day or two before so that I don't have to worry too much. And then we also have really young kids who start asking questions 2 weeks in advance, and that really we know as parents or as caregivers, if we know those kids, that they could handle that and not find that it's affecting their sleep, affecting their ability to think. Typically, I tell the youngest children a day or so before. So with like a 4 and 5-year-old, I might start talking about, we're going to get your belly fixed more like a week or two before, or maybe even before then, but I don't give them specific details until closer. And again, each child is different. I know for my own, I have 2 9-year-olds, and I always say, do what I say, not what I do, or please don't watch me when I'm with my children who are scared of needles. But, I tend to not tell them, and they're 9, so that's the school age group, about getting a vaccine until the day before, because they're just going to worry. They need to know in advance, but the day before is enough time for them. And I've learned that over time. And so, just take this as a general sense of when to tell kids, but just remember that each child is different, and trust as a parent that you probably know what's best for your child. Like, is this a child that can handle a lot of information in advance, or is this a child that you can have a basic understanding the surgery is coming and give them more details closer? Or is this a child that maybe we shouldn't even talk about the surgery until a few days before? So what to tell a child about a medical visit or procedure? Again, the honest thing is really important. When the children are given information that turns out not to be true, as we said before, this is when they develop a distrusting relationship. And so these can be really simple things. And that's where that flexible language comes in. And there's been great research also that shows that kids that don't trust the medical environment as a child, this goes on to have impact as an adult, and they might, avoid medical care. Some very simple things that I see some of my colleagues say, and actually, when I brought my kids a couple of years ago for their first COVID vaccine, a nurse said to one of my daughters, "This won't hurt at all." And I never tell children, and we're going to talk in a moment about what I say when kids ask, "Is this going to hurt?" I would never say to a kid, "This won't hurt," because we don't know how a kid defines hurt. First of all, younger kids say everything hurts when really it might be that it feels different. They feel pressure, but they use the word hurt. And so I don't want to invalidate that. But also, I don't know how it's going to feel for a kid. And maybe what that nurse meant was it doesn't hurt as much as, or it only hurts for a second. But I don't really want to, that's not usually an honest response. And in fact, when we were leaving, my daughter said to me, that girl lied to me. Why did she say it wasn't going to hurt? And it hurt me. Tell your child what will happen before and after the procedure. And we'll talk a little bit about that in a moment. But really, so when I work with kids, I create sort of a visual checklist for younger kids of sort of with pictures and words, what's going to happen, the vital signs, if they're going to get an IV before, if it's a medical procedure where they have to be admitted and have a GI clean out, will they have a tube in their nose? And I tell them those things so that they're prepared. And then after, when you wake up, what's on your body? Each time I'm going to a medical procedure with any kid, I reach out to the physician and I ask a lot of questions. Will they have this tube? Where will it be? Will you cover the incision with gauze, or will there be stitches? Will those stitches need to be removed? How long will they have that tube in? And as parents, even if you don't meet with me or meet with Caitlin, these are questions you can learn to ask your providers. I even call the pediatrician before each of my, I'm sure they love this, each of my child's well visits to say, is there going to be a vaccine today? Is there anything different? Even when my kids had to get the vision scan, I made sure that they knew, hey, you're going to do something different today, or they were getting their ears checked. There's something else you're going to do that we usually don't do when we go to the doctor, so that they start to see that I'm going to tell them exactly what's going to happen, and that they can trust that what I say is usually what happens. And kids really want to know like what they're going to experience. They don't really care about like what other things. They want to know like, what am I going to hear? What am I going to see? What am I going to smell? What am I going to feel? All those kind of things. In fact, an area where most kids, unless you end up in the ICU, end up waking up from their surgeries, for example, in an area that sometimes has walls and doors, but sometimes has sort of curtain spaces. And one of the things that I think is really anxiety provoking for parents in particular, but also for kids, is that even if your child is calm, there's lots of kids around crying and screaming and making noise. And I actually alert families to that one thing, so that they're not surprised when they hear other kids. And I also talk with patients about why kids might be crying. That doesn't mean they're in pain, and it usually doesn't. They're confused. Their belly might be a little sore. They don't know where their mom is. And so we talk about reasons so that when it happens, they're prepared. So important details that you might not think of to include, that I've sort of talked about some of these, is so when they're having a surgery or any kind of procedure under anesthesia, if they don't go to sleep with an IV in and they're going to wake up with an IV in, I like to tell them that. I might use the word IV. If your kids call it something else, or they've never had one, you want to call it a tube in your hand, you can. But I sort of use the language that children and families use. A Foley catheter is the tube, for example, tube in your penis, or for a tube in your urethra, which is where the pee comes out. So, for girls, obviously wouldn't be in their penis. So I talk about, where that tube's going to be and why it's there, and also when it's going to come out. How they might feel immediately after procedure and throughout recovery. So it's really, when I'm working with kids for pre-surgical visits, I often talk to them about how pain works with surgeries, that usually when kids wake up, they kind of feel okay. They don't feel a ton of pain, and that's because they have a lot of medicine in them. And then over that next few hours, sometimes the next day, there's a drop. And then pain, what I always say to them, that the pain is like an injury and it gets better over time. And so like when you scrape your leg, what happens? It hurts a lot at first and then it gets better. And so I talk to them about how it moves in the right direction, but there might be some bumps along the way. And then, what the procedure site will look like. So if there is going to be a little red there, I worked with kids that have had urological procedures, that when they first go to the bathroom, there's going to be some red tint in their urine. I actually tell them about that. I had an experience with a girl who just no one told her that and didn't really think it through. And when she went to the bathroom and saw red, and really freaked out. And if I would have just explained to her, that's where your surgery was. So it's not uncommon to see a little red in there. Or a dental procedure, you might have a little bit of red, and that's a little bit of blood. And also with those kind of procedures, you can talk about mixing with saliva or mixing with pee. So it might look like there's a lot more than there is. So what if a kid asks, will it hurt? And this is, I think, a common thing. I think this is probably one of the most common, the three most common things kids ask me when I'm preparing them for surgery is, what if I wake up during the surgery? What if I don't wake up after the surgery? And so I teach them, I give them a lot of education around anesthesia and how anesthesia works, and how we can be really confident that those things will not happen. And then the third thing is, I'm going to have pain afterwards. And so the basic advice I can give is, don't predict pain. So you don't want to say, oh yes, it's going to be terrible. However, yes, most kids in particular, if we talk about surgery or even getting an injection, it does hurt for a moment, right? But I try to soften language around it and give kids choices. So I might say something like, if they're getting an injection, well, some kids say it feels a little sore for a moment, or that it might burn a little bit, but that they usually feel better right after it's done. And other kids say they don't feel much at all. And I am not sure what it's going to feel like for you, but you'll let me know. And so I'm very honest with them. As kids get older, I might use more intensive, I want to be very honest. I try to be really honest. So I worked with some kids recently, 16, 17-year-olds that were having a significant spinal surgery. And they asked a lot. And I said, a lot of kids describe having a significant amount of pain right away. But there's things, and we talk about the things they can do. And then we also talk about that cycle, that things get better over time. So again, not predicting pain all the time, but also being really honest that you'll probably have some sensation of something and what pain feels. And everyone has a different pain threshold, right? So what that feels for you will change. I'm going to turn things over to Caitlin now. So I'm going to quickly switch places with her and let her have the hot seat.
Thank you, Lauren. Good to see everybody today. So the next goal that we're going to talk about is identifying specific strategies to help your child effectively cope with medical procedures. So let's first talk about coping, right? So what is coping? So coping is really how a person deals with or overcomes a challenging situation or a problem. And, this can be in a variety of different ways that we can cope. It can be through our thoughts or also our behaviors or our actions. So I always think it's really important to identify that every child is going to cope differently. What works for one child might not work for another child, and that's okay. And the goal here is really to find out what works for your specific child and their needs. A lot of times when we think about coping, we're going to think about their previous experiences. I know we talked a little bit about that earlier in our presentation here, but that those previous experiences can really impact how their coping outcomes look. So like we mentioned before, if they had a really positive experience with a vaccination they felt really good about it after, they didn't feel like it hurt that much, they may feel really confident and comfortable and excited to come, for another one. But if they had a really hard time and they had to have multiple pokes and they had a hard time kind of recovering from that experience, their coping could look a little bit more challenging, or they could be really upset and kind of having a hard time finding strategies that really help them. A lot of things can go into this previous experience factors, but also if you really think about the timing of things too can make a difference for a child. So is this procedure happening around the holidays or around an event at school that they may be missing? That could make their coping a little bit more challenging if they're feeling like they're missing out on something. How much the child understands or has access to their coping tools can also make a difference. And also the support and presence of caregivers can also impact the ability to cope. And coping can change over time, so it can ebb and flow. So, you might have an experience where your child, copes beautifully one time during a blood draw, and then next time they come in, maybe they needed an extra poke, or it was just a different day in general of how they were feeling, and maybe that next time their coping looked really different, and they maybe had a harder time coping with it, and that's okay. Coping does change as the child grows and different experiences, but we really want to do everything we can to promote positive coping so that children have positive experiences in the healthcare setting. So one way to do this, this kind of ties in with our preparation piece, but also can be used in the moment during a medical experience as well. But here at Boston Children's Hospital, we have the My Hospital stories. And these stories are created to create predictability and support a child's coping with an experience at the hospital. So the examples that we have up here on the slide are from surgical My Hospital stories, and it really does provide some simple, reassuring language and some descriptions of what will happen. So it's providing that predictability, but also kind of a sensory aspect to it as well. So you can see on the top picture here, we have the nurse will check my blood pressure. I'll feel a small squeeze on my arm. I can remember to hold my body still and take deep breaths. So it's providing that information of what they can expect. And this slide, it's also does provide some coping strategies as well, like I can take some deep breaths. And then the slide down at the bottom there, it says, when it's time for my surgery, my doctors and nurses will move my bed to the next room. So this is really important. You know, most of our beds at home and children's beds don't have wheels on them at home. So that's something that's definitely different here in the healthcare setting. And that might be a surprise to some kids. And so knowing that this bed moves, it has wheels, and that my doctors and my nurses will wheel my bed and be with me when it's time for my surgery can really help them create some predictability. These stories also use real children modeling the steps. So it also has that sense of normalcy and kind of an opportunity for children to connect and say like, oh, other kids did this too. What to bring to the hospital, that can really affect a child's coping with their medical experience. So right off the bat, we always encourage families to include their child in packing for the hospital. You know, allow them to bring their favorite stuffed animal or blanket or maybe a special toy or activity that they enjoy doing. This can really give them a sense of control and also include them in their care. We also encourage you, when you use these items in the hospital, it can also help you kind of create predictability and a sense of comfort from following routines that are similar to your home environment. So some kids may not like being away from home, and sleeping over at the hospital could feel overwhelming. But if you're following some of these tips and following routines at home, like maybe perhaps reading a book before bed, or following your screen time schedules, or even morning routines, can really make a difference. And you know, we know that children really thrive off routines and predictability. So if we're able to provide that here in a hospital setting and tie in some of those things that you all do at home, we know that we can kind of create a more comforting and supportive environment when the children are here for procedures or admissions or any hospital experiences as well. Next, we're going to talk a little bit about distraction. So distraction is one of the most effective ways to cope with medical procedures. There's a lot of research out there about the powerful tools that can be used when we incorporate distraction. So distraction really gives the mind something else to focus on besides what is happening around them or perhaps a medical procedure. So let's use blood draw, for example. If that's something that the child is really anxious about, maybe they don't like seeing needles, and their mind is just really focused on that needle. Using distraction can really be a game changer for a child. So we can adapt distractors to meet the needs of a developmental level or an interest of a child. Again, you all know your children best, and every child's different. So we really want to individualize that and find out what is going to work for this child. What is something that they're really interested in and could really hold their interest in, something that their mind could focus on in a positive light. So there's a variety of ways that we can use distraction. There's different types of distractions, so you can use assorted visuals. So those are things to look at and engage the mind in. So here in the picture, you see that the child is looking at an I Spy book. So that is stimulating the mind, giving them a task to focus on. So they're not focusing so much, in this example in the picture here, on the leads that are being placed on their head. We can also use things like light spinners or different sensory toys for some of our younger kids. You could also use things like a phone or a video. Maybe a teenager has a favorite app that they have on their phone. Maybe they could be engaged in looking at that. It can really make a difference, and so they're not focusing so much on something that could make them anxious. We also love to encourage breathing techniques. So regulating your breathing, we know from a medical standpoint, can lower anxiety, keep your body calmer, and for certain medical procedures as well, make them more successful. So if your body's not so tight and anxious, if you're a little bit more calm, it can make it easier on the providers as well. So those could be simple things such as box breathing, like breathing in for a certain amount of time, holding it and breathing it back out. It could be counting your breaths, taking nice, slow belly breaths. So there's a lot of different ways that you can implement that either on your own and kind of coaching your child, or also using some apps. There's some really great apps out there that can help with breathing techniques too. We're going to think about the positioning of a child. That can really help as well. If a child is in a position that is natural to children. So for example, if you have children naturally sit on caregivers' laps. If we are doing a vaccine and the child is able to sit on the caregiver's lap, that can make a huge difference of just the sense of the comfort from the family or the caregiver. And it's a natural way, like they're used to sitting that way. That is definitely a preferred option over perhaps, sitting on their own. That can feel really scary and daunting. And if they have kind of that sensory input of a caregiver with them or holding their hand, that's something else that they can kind of focus on as well. And then lastly, diversional talk can be a really powerful tool. Engaging a child or a teenager in conversation about something that they enjoy, or some general questions can really give them something else to focus on. And usually if you can get a child talking about something that they really love, they're excited about that, they're feeling calmer, it can really, again, divert their attention away from something that may feel overwhelming to them. The next thing we're going to talk about to promote some positive coping is medical play and exposure. So medical play really allows children to express their thoughts and feelings. It gives them an opportunity to feel in control and achieve some mastery over a situation. So there are a variety of different ways that this can be done. So we know that children's most powerful and natural way to communicate is play. Children will play out scenarios very naturally in their play, and they work through a lot of different things through their play. So if we're able to provide medical play with a goal of either familiarizing the child with some medical equipment, or maybe even making the medical equipment feel less threatening and kind of giving them a chance to feel in control, it can really go a long way with how they're feeling about the medical environment. So for example, before a child has a temperature taken, maybe they're really nervous. I know a lot of the younger patients that we see here at the hospital can be a little bit timid about the thermometer going across their head. Maybe we can practice on a teddy bear first, or maybe we can practice on a caregiver first and kind of modeling those things, or maybe the child can explore that material before it's time for them to have that done on their body. It can really reduce some anxiety and make them feel more comfortable about it. Another option, you can use real medical equipment or like a doctor's kit and play, and just preparing yourself before you come to the hospital. If you know, like a set of vital signs are going to be taken, the child can, like you see in the picture here, the child is practicing some of those vital signs and basic care things with a baby doll beforehand. So that could always be an option too. And we can also use medical equipment in non-traditional ways as well. So those could be things such as decorating an anesthesia mat with stickers prior to going back for an anesthesia induction, or painting with medical equipment in non-traditional ways, like syringe painting, or even catheter art or beading with catheters can be something that can go a really long way in just familiarizing children with those objects that may not be as familiar to them if this is a newer experience. Another thing that can really help with a child's coping is bravery prizes. So this is really something that helps to create a positive association with a medical experience. So almost kind of like a reward after they go through something that maybe was challenging for them or something that they really didn't want to have to do. And I think that it's important, just before we dive a little bit deeper into what this looks like, is that it doesn't have to be anything big. It doesn't have to be anything tangible for it to be a bravery prize. So a great example, say your child is coming in for a blood draw, and they're really anxious about this, and it's something that they're feeling a little bit worried about. You could do a variety of different things as kind of a motivator. So, you could say, when we're all done, we get to go to the toy store and you can pick out a toy. It can be like that, or it could be something like, when we're all done, we're going to have a movie night and you can stay up a little past your bedtime and we can have some special time together because you were really brave today. So again, it doesn't have to be anything expensive or big or tangible. It can be kind of an act of something that you do together with your child. And again, it can be based off their interest. And we know that bravery prizes really help motivate kids to cooperate. So it can increase your cooperation in medical settings and also give them something to look forward to during that procedure or tough time. Some of our younger kids may need something that's more immediate and a reward right after. So maybe you bring a special object to the hospital for their bravery prize. And as soon as they're done with their vaccine, they get that object. Where older kids may be more comfortable earning a larger reward or over a longer period of time. So maybe, they've been wanting a new outfit and they, once they do a certain amount of things, maybe they can go and get that outfit. So it really can, again, be adjusted to your child's needs, to your child's anxiety levels. But it can be a really great way to promote some positive coping and kind of give them that positive experience of, I know you did something really hard and I acknowledge that and we're so proud of you. Some other ways to just increase cooperation in the medical setting. Research has found that if you can provide immediate specific praise for good behavior, it can be really, really helpful for children. So that could be something, as soon as you see it, you're providing that feedback to them. So saying something like, you're doing a great job keeping your body still while the nurse checks your ears. That is very specific, and you're saying it in the moment, and they're feeling that praise for doing something that is the expected outcome or the good behavior that we are looking for in the medical setting. Using that language versus you're doing a good job is a little less clear. It's not really telling the child what they're doing a good job at or why or anything like that. So that can be a little bit confusing to children. So when we use examples that are specific and we're providing it immediately, that can really help the child feel clear with kind of why the caregiver or the provider is feeling like that is a great option for them to be doing at the moment. We also want to focus less on what not to do. So saying things like stop moving your body or don't move your body so much, to the child, they're perceiving that as a don't, right? So you're telling me what not to do, but I'm not really sure what you want me to do. Maybe they're feeling anxious or antsy, or they've been sitting a long time in the appointment. So if we can provide things in a positive light, or things that you expect to see, that can give the child something tangible to say, oh, okay, mom's asking me, to keep my body still. That's a little bit more clear than don't move your body, or kind of a negative tone to there too. It can be really helpful to provide realistic choices when providing options to children, as it promotes a sense of control. So this one's sometimes a hard one if you kind of think about switching your language. But say, for example, it's time for a child to have their medicine. If you go up to a young child and you say, would you like to take your medicine? Odds are they're probably going to say, no, I don't want to take my medicine. It doesn't taste good. I'm in the middle of playing, whatever the reason might be. But we know that medically it's time to take our medicine. This is something that we have to do. Unfortunately, it's not really a choice, something that our body needs. If we can frame it as a choice for the child, such as, it's time to take your medicine. Would you like to take it in a cup or a syringe? We're giving them a sense of control and a choice that really does increase their cooperation and a sense of ownership over part of that. Or would you like to sit on the bed while we do your vaccine, or would you like to sit in the chair with mom? So you can kind of decide, and it does give them that sense of control and also participation in their care. We also love to have them participate in a variety of different ways too, like giving a child a job during a procedure can go a really long way. It can be something like, can you count to 10 for me? It could be something like a distractor, or it could be something like, oh, would you be able to help me take off this bandage so we can do a dressing change? So giving that child a job has them participate and also gives them something to focus on and feel like they're part of their care and a sense of control. You can also make it kind of fun too, like a beat the timer kind of activity or game. Maybe a child post-operatively is having a hard time with their liquid intakes, and they really need to increase their fluids. So maybe you could make a game out of it. I'm going to set a 10-minute timer. Do you think you could finish this cup of water before the timer goes off? So anything you can do to kind of make it more child-friendly and give them kind of a sense of control can really increase cooperation in medical settings. So our last goal for this afternoon is to really learn about when and how to get additional support for your children. So, we've talked a little bit today about, common fears, reactions, how to prepare children and strategies to use, but it's okay if your child also might need a little bit of extra support, or even the family unit might be looking for a little bit of extra things. So when to consider reaching out for additional supports, whether it be through the Child Life Services Department or through Lauren with her general surgery preparation. Definitely think about kind of if this is a new or a significant medical procedure, and you anticipate that this could be kind of a big thing for the child or your family, that's a great time to look out for some extra support, as we have lots of resources and kind of help prepare you all for those experiences. If your child has historically had a hard time coping with previous procedures, that might be a great time to reach out and see, this is what we've been doing in the past. It's not really working. What could we think about this time? And what can we do to individualize this for my child to make this a more positive experience moving forward? If you're noticing that your child is refusing to cooperate with medical procedures, or even maybe it's really hard to get into the hospital building itself, that's a great time to reach out. We definitely have some strategies and tools that we could use to make that visit or kind of that experience positive for children. If you notice that your child's distress is really interfering with their daily functions outside of the hospital or medical environment, so maybe they're not sleeping well, or they're having a lot of nightmares, they're having a really hard time separating from their caregivers to go to school or to go to their favorite preferred activities, or maybe even you're noticing baseline changes in their behavior. Maybe they're not eating as well. Maybe they're having some behavioral outbursts that is not typical to their normal behavior. Those are all key indicators that maybe your child is feeling a lot of stress and might benefit from talking some of those things out and learning a little bit more about what to expect and maybe some coping strategies to help them navigate those experiences. And also, if your child has a lot of questions, that can be a sign too that they're seeking a little bit more information than maybe the baseline that you might have available. We always say it's okay not to have all of the answers. That's totally normal. But definitely, reach out to your medical care teams or any of us to see if we could definitely be of support to your child and your family unit as well. So I'm going to turn it now to Lauren. She's going to talk a little bit about how to reach out or extra support in the department.
Great. So, for the surgery department, if you wanted to meet with me, and I see kids with any kind of surgical procedure, it doesn't have to be in general surgery, it could be in orthopedics and in ophthalmology, wherever, you would call the surgery department and just ask for an appointment with me. And usually I start seeing kids a few weeks before their procedure. And I do see some kids with day procedures. It doesn't have to be a major surgery. They're having a scope and they're concerned about that. And that's how you reach out to me.
Perfect. And as for child life support, you can reach out to our Child Life Services Department. Here we have listed the phone number or the email. And when you give a call, you can include any information that you know. If you know about a planned procedure ahead of time or when and where it will take place, any info you can provide to us, our admin team will reach out to the appropriate child life specialist to provide some support. Either before that appointment or during the appointment. And if you're in the hospital for a procedure or a hospital visit and your child's having a little bit of a hard time, you can always ask your area to see if there's a child life specialist who may be available to meet with your child as well. Perfect. So we just want to thank you so much for joining us today. We have up here the Family Medical Coping Initiative slide here where you can access all of their webinars and videos by either using the QR code here. So we definitely encourage you to check out some of their resources as well.
Thank you so much. That was a wonderful talk, really rich and informative. I'm sure people really loved it. And I don't know if we had any questions.
I don't see any questions in the Q&A, but if anybody has one, throw it in there now and we will get to it as quickly as we can.
I just have a quick question for you guys, and it's just have you noticed that kids are less afraid of masks post-COVID? And I'm just curious what you've seen with that. Because it used to be that kids were afraid of, doctors or people coming in with masks. Have you seen any difference in that?
Definitely. I'll say, at least from my perspective, it's so normal to them now. They're used to even wearing masks themselves in their home communities or when they come in for medical visits. So I definitely have seen a decrease in children's anxieties or kind of increased comfort in being around masks and being more familiar with those. That was a great question.
It's just maybe some proof that exposure to things really does help reduce anxiety.
Sure does. Absolutely.
Well, I don't see any more.
There is one more. There is one question.
Oh, thank you.
A couple questions actually now.
Oh.
Do you want to take them, Annie?
Sure. I see the first question is, are there support for older siblings? This person says they have a 4-year-old child and the baby brother needs surgery soon. Any response to that?
Yeah, even I would be willing to see as my primary patient the sibling, if preparing the sibling is going to be really important in a situation like that with a baby. For kids that there's maybe 2 kids, a sibling and the patient's a little older, I might see the patient, but then I've had many experiences where the sibling comes in to learn also about the procedure. And I also talk to the parents a lot about what does that kid need to know. They might not need to know the specifics about right after the surgery, but when they come to visit, they'll need to know what they'll see and when what their sibling can and can't do, when they can get back to tackling each other, all those kind of things. Also, they're going to experience my mom's or dad or whoever it is isn't going to be around. And my sibling's getting all these gifts and I'm not, and that's a whole nother talk. So yes, we definitely, and I know in Child Life also tries to really include siblings. They're so good about like, here's a prize. You want to give this to your sister when you go home too? Here's another one.
Yeah, we definitely incorporate siblings in our care as well, and kind of helping promote that connection too between the sibling and a hospitalized child as well.
So thank you. I see that it's 1 o'clock. I'm sorry, we have one more question here. We will try to get back to you with an answer to that question at a later date, because we'll certainly respond. But I just want to thank Dr. Mednick and Caitlin for being here today and giving us this great presentation. We really appreciate it.